Adipose tissue. This is our first slide of adipose tissue, and at this magnification we're using the 4x objective for a total magnification of 40 times larger than it really is. And at this magnification it's hard to see a lot of details, but we can see the big expanse of adipocytes full of fats. Now at this magnification we're using the 10x objective for 100 times larger. We can actually see some details on the adipocytes, including some nuclei. Adipose tissue can be confused with simple squamous tissue from a lung slide, and I would like to show you a 10x objective slide of simple squamous for comparison. Now notice here the adipocytes have smooth cell walls, and here we can see a 10x objective slide of simple squamous tissue from a lung cross-section, and if you look carefully you can see that the walls are made up of single cells and each has a nuclei. So there's a rougher look to the cell walls than compared to adipose tissue. Here is a slide of adipose tissue using the 40x objective, so these cells now look 400 times bigger than they really are. And at this magnification we can easily see the nuclei of the various adipocytes. We can see the very smooth wall of an adipocyte, and this is just full of fat. It's a fat storage area. And we can compare this to a slide of simple squamous epithelial tissue, which is often confused at the same magnification. But if you look carefully, you can clearly see these irregular individual cells making up the cell walls in this cross-section of lung tissue. So this is something you want to be a little careful of when you're taking a test and trying to compare these two tissues. Look for smooth walls without individual cells and just a few cells scattered as nuclei to basically a big sac full of fatty oils or lipids.